Hi, welcome to The Surgeons. I am Dr. Wesley Hall.
I'm Dr. Scott Wrye. I'm the better doctor and the more good-looking one.
Well, that may be true, but you don't care about that as the studio audience. What you're here to see today is us making fun of John, who is our new cameraman who's joined the team over here. We're very excited to have him because he's back there telling me what to say, what to do, and I think he has absolutely no experience.
And he also said you had no energy.
Well, we said we needed a stronger opening. That's why John's here. He's back there doing like fist pumps and push-ups in the corner.
Anyways.
I hope that was a strong opening like John said we needed.
Well, I think in all seriousness, I think we're going to have a great show today. We're here to talk about a patient of yours who is a very exciting patient because we've got a lot of really fun and cool things to talk about.
Well, she's actually a great patient. She is a patient who a number of years ago, about 5 years ago, came in looking for facial rejuvenation. And she had, amongst other things, a lower facelift. She came back about 5 years later and says, you know what, this has been great, but I'm now looking for a little more rejuvenation. I want to have that again. The facelift itself, as I will tell patients, it lasts forever, but we don't. Sure. We continue to age.
Sure.
And as we age, we're all going to notice things that change. And in her case, she started to say, hey, I'm feeling like I want more rejuvenation.
Sure. Let me ask you a couple of questions. How old was she when she presented to you the first time for her first facelift?
Well, she's late 60s. She's now in her 70s.
Wow.
And she is, you know, a super vibrant, very active, very successful business person.
I would also say she has higher energy than you or I put
Probably
together.
so. As you had noted,
Yeah.
you're low energy.
Yes, I am. I'm just even keel energy.
You were telling Matt that earlier.
Yes.
And he said, we need more energy. Any rate, Laren has not that problem. She is a super energetic individual.
Absolutely.
This is frequently something that patients will tell me. I don't know what they tell you. I think it falls upon deaf ears when you're
Absolutely not.
That patients will say, I feel like I'm older than I feel.
Sure. Well, people are more active than they were 20 years ago. They're healthier than they were. And you could be in your 60s and 70s and still feel great and be very active, but not like the way you look. And so they often say similar things. They say, you know, I feel inside differently than I see myself in the mirror. In the mirror, I look like an old person. On the inside, I feel like I'm a young person. And so that's what they're hoping to change. They're seeing, they want to see an improvement in that outside appearance.
I feel like you look like an old person too.
I am an old person.
Do you ever have a patient who comes in and says, I'm too old to have this operation?
Well, they don't come in to say I'm too old because they often wouldn't be there, but they're concerned that they're too old. So they say, hey, Dr. Wrye, I know I'm here and I have all these worries, but don't you think I'm too old to do this? Or don't you think it's silly for me at my age to do this? So what I I don't sell them anything. What I tell them is that if you would have a positive improvement from looking more youthful in your demeanor and being happier, maybe going out and doing more things, then it's worthwhile considering, because a lot of these patients, in spite of their advanced age, are very healthy and they can tolerate a surgery without any problems whatsoever. So if they're going to feel happier, I think it's a great idea.
I would also argue that...
Are you arguing with me?
Yeah, I'm going to argue the heck out of this. This is now the show, The Attorneys. At any rate, a patient's physiologic age is much more important than their chronological age.
Sure.
Because you may have a patient who comes in who's in their 50s,
Absolutely.
who is in poor health, has multiple issues.
Yep.
That's not a patient that I'm going to be saying, hey, you're a great candidate for
No, those are
facelift.
bad candidates for surgery.
Bad candidate.
Yep.
Whereas if you have a person who's in their late 70s who is vibrant and active, there's no reason why they shouldn't be allowed to
Absolutely.
say, I should consider the surgery.
Absolutely. You know, with modern medicine, in a modern operating room with an anesthesiologist that monitors you during the entire case, it's actually a very low stress operation of the body. Patients do remarkably well.
Well, we are going to have Laren come in. She's going to go through her process So we're pretty excited to see her back. She's just a super great lady, great patient. And I know that we're hoping that the audience is going to get to learn a lot about facelifts today.
Good. We'll see you in the next segment. Welcome back to The Surgeons. Today we have Lauren with us. She's got a personal story that she'd like to share with us. She's going to be a patient at Dr. Hall, so Dr. Hall, why don't you tell us what you guys have in store?
Well, to make everything perfectly legal and honest, Lauren actually is a patient of ours, right? We had done a facelift
A full
number of years
facelift.
ago. And tell me exactly how many years ago that was, because I'm starting to get a little...
I'm thinking it's 4.5, right around that time.
It's getting close to 5 years.
It is.
And you had something that you loved. You said, this is great, but now it's time to do more, you said.
I'm turning 70 in just a few days, and I'm seeing that my chin is just a little bit soft. So I was hoping that you'd be able to pull that back a little bit for me and make me look maybe, you know, a little less than 70.
Well,
30?
I think
You guys shooting for
40's
30?
good. I
Yeah,
could go
okay.
for that.
30's good. I know when we did this last time, you said this did wonders for how I felt.
It's spectacular. I'm very lucky to have many accomplishments. I run a company in Hawaii that's world famous, and I didn't feel world famous inside. And I have to tell you that the response from people to my face made me so happy. It was the happiest thing I've done, including my own company.
Well, and I think that, like with many, many patients, as we continue to age, we start to see changes that go on. And even after a facelift, these things can happen. And here we are 5 years later, and you're saying, yeah, I think it's time to do a little bit more.
I don't look bad. I look pretty wonderful, frankly, but it's just a little soft right here. It would make me feel so much better.
Do you have some other things that you're worried about?
I do.
What are those?
I do. I've gained a little weight, and because I'm nearly 70, I'm not really going to go into any kind of big diet for the rest of my life. I'm pretty much through with that. But I do have some lumps and bumps that I'd like to have taken off me.
I'm almost 50. I've got lumps and bumps too.
Well,
You're not alone.
You don't have 2 5-pound loaves of bread on your butt.
Mine are 4.
Well, mine are following me 10 minutes into the room after I arrive. So I have never had a butt in my life, and I just as soon have it gone.
So what are we going to do with these loaves of bread?
I believe we're going to have liposuction, and we're going to take them out. Now, Dr. Hall told me that I wouldn't have Christy Brinkley's butt, and I'm okay with that. Let me just say one more time, I'm going to be 70. I'm sure it's going to be age appropriate.
I have eaten in your restaurant on more than one occasion, and I can totally understand how you might say, I'm going to be gaining a little loaves of bread anywhere around.
Yeah, well, you know, it's cheeseburgers, for God's sakes. You're on vacation, you got a Mai Tai, you're sitting on the water, and the loaves of bread come. What
And
can I
it's
say?
awesome, it's awesome. I think that one of the things that when we talk about doing these surgeries, people will frequently be concerned about, oh my gosh, that looks like that's going to be difficult, that's going to be a huge recovery, it's going to be terribly painful. And here you are and you're saying, I think I'm doing this again.
You know, many people asked me about the first facelift, and they wanted to know, did it hurt? And I said, a broken bone hurts. I don't recall any pain or major discomfort after the first 5 days. So I was in very good shape, and I wasn't young when you did it.
Well, you know, that brings up something interesting. A lot of patients ask me, hey, Dr. Wrye, I'm 70. Am I too old for surgery? And really, there's not a chronological age that we adhere to. It's really, how healthy are you? I mean, you've obviously done well with surgery 5 years ago. I anticipate, obviously, you'll do very well with this one. Did you feel like you had trouble because of your age at all?
No, and I did ask Dr. Hall, was I okay
Yeah,
at
but Dr.
70?
Hall
and
doesn't know what he's talking about.
But he made me feel so much better.
Well, I do think that a lot of it, when we're talking about age, physiologic age is certainly what we're important
Absolutely.
when we're dealing with surgery. How you feel, though, is another thing. And as you had said, I just felt like I'm younger than I'm looking right now.
I felt unhappy I didn't look the way I felt inside.
Well, I think that
you are a great person. I know all the good works that you do, not only in your business, which I think is the greatest work that you can do, is having a successful business, but also in some of the humanitarian stuff that I know you're involved with as well. We're so happy to have you here. We're glad we're going to be doing this. We're going to be moving on, showing surgery at a later time, and we're going to wrap this up, I guess.
Yeah, and I want to thank you for coming on and sharing your story. And I think we've got a lot to look forward to, seeing her surgery, seeing her post-operative results, not just her delayed results months later, but within a week. We're going to see a lot of fun stuff.
So today we're operating on Laren. She is coming in with concerns about an aging face.
So what we're witnessing is lower facelift. We like to describe it as the lower part of the face that we are rejuvenating. Certainly we can also rejuvenate other portions of the face, the mid portion of the face, the upper portion of the face, the eyes, so on and so forth. But the lower part of the face, we're generally referring to the neck and down in the jowl region.
When a patient is coming in to have a facelift, it usually involves nothing to eat or drink the night before, like with any surgery that we would usually perform. Patient would come in to the surgery center, would be met by the staff, prepared with an IV. They're going to get some sedation from the anesthesiologist. Generally, the surgeon will see the patient, will review what the plan is. For this kind of a procedure, a lower facelift that we're performing, I'll usually make most of my markings on the patient in the operating room after the patient's asleep. After the patient has been sedated, I'll confirm the markings around the ears, and I will usually infiltrate the patient with some numbing medicine. The numbing medicine does a couple of things. Number one is it does provide some anesthesia, some local anesthesia. So even though the patient's asleep, they're generally not feeling anything unless anesthetic needs to be used. And the other thing that provides, that numbing medicine, is that it provides a little hemostasis. It helps to control some of the bleeding. So when we're doing a facelift, if we've instilled the numbing medicine into the area, there's not a ton of bleeding usually that we encounter, and we can proceed much faster in such a situation.
The incisions that are made are generally made around the ear to try to mask the scar, the resultant scar that's going to occur. That scar usually heals very, very nicely. Every patient is obviously different. In what we've witnessed today, this is a repeat. So the patient, as we had described, had had a facelift about 5 years ago, just was ready for a little more freshening. This is also highly dependent on patients. People will frequently ask, how long does a facelift last? Well, the facelift lasts forever, but we continue to age. And a patient may notice after several years that they're showing signs of further sagging, further aging that they may want to address. So a secondary facelift is certainly something that can be done. It's not necessary on every patient, certainly. I think that what you've seen in this case is pretty standard stuff.
After we've elevated the skin and we've gotten the flaps loosened up off of the underlying tissue, the underlying SMAS layer, we'll generally then talk about tightening the SMAS layer. This involves placing stitches in that layer itself. The patient that we're operating on and what we feel we might want to do to the underlying structures, sutures are placed in that to tighten that layer and to make sure that we've got adequate plication or tugging of the underlying SMAS layer, the tissues underneath the skin. This might commonly be referred to as tightening of the muscles under the skin. After that has been done, then we'll usually take the skin and begin to pull it back and tighten the skin. And this goes from the neck all the way up to the upper part of the cheeks
and we pull the skin back all to the appropriate tightness. It's then cut off at an appropriate level, and then we place anchoring sutures to tighten the skin and put it in the appropriate position. After that's been done, I'll usually go to the other side and do the same thing on the other side to try to get as much symmetry as possible, and we remove the extra skin just by cutting it away. Following that, we then sew the skin up to make a smooth transition from the operative area to the part of the skin and the scalp that hasn't been tightened.
The recovery time for this is actually one of the things that I would say, and I would think Dr. Wrye would also concur, is a relatively easy thing for the patient to go through. Generally, there's not a tremendous amount of pain, even though you look at this and you think, my gosh, it looks like there's a lot of surgery going on, this is going to be a big deal. Well, it is a big deal like any surgery, but in terms of pain, it's generally very, very well tolerated. Most patients will say, this doesn't really hurt so much. I needed maybe 1 or 2 pain pills, and they didn't require much in the way of pain management after that. The recovery time in terms of when they can return, when the patient can return to normal activities varies, but generally within a week, patients should be back to doing many of the normal activities that they were engaging in prior to the surgery. Certainly we need to be gentle with the face. We don't want a patient out kickboxing or doing something where they're going to get hit in the face or traumatize the face in any way. This is a recovery time that after several weeks, really they're back to completely normal activities.
Welcome back to The Surgeons. We are here talking about facelift surgery. If you've just joined us, we've just witnessed some actual surgery.
If you just joined us, you missed all the good stuff. You missed me talking.
Yeah.
You missed our interview with your patient, and you got to see surgery. So I hope you're not just joining us. You missed a bunch of stuff.
Well, you can always go TiVo this stuff later. That's the important
that?
stuff. That's the thing that technology has.
I don't partake in technology.
At any rate, the facelift that we've just seen is a lower facelift. We've been talking about lower facelifts here today. This is opposed to, say, a mid facelift or an upper facelift. When you're talking to a patient and a patient comes in saying they want facial rejuvenation and you talk about the things that you can do for them, what are the most common things that you see with faces?
Well, to take one step back before I answer your question, I do see the exact same thing that you do. Patients have specific concerns, or at least I want to try to identify what those are. So patients complain about their jowling. Patients complain about loose skin of their neck. Patients might feel that they're getting a little flat here. They might feel their brows are down. They might feel they have excess skin around their eyes. All of these things need different procedures to treat.
Because I only had the lower half done, I didn't have the eyes or the upper half. I mean, I looked pretty darn good coming out of surgery. I'm only 5 weeks out of surgery now. My neck feels great, it's tight, it's exactly what I wanted. My neck was what I was mostly concerned with, and some wrinkles on my cheeks, but I mean, it really looks fantastic. And I probably need a few more weeks for the swelling to go down, and then your face needs to settle. But everyone I see, especially my close family, is just amazed and they think it looks fantastic.
Hey, I will frequently have a patient who will come in and they will say, oh, doc, just fix it all. Do everything there.
Yeah.
And I know that you were trained well, and when we were trained to try to elucidate what exactly the issue is.
Sure.
Because it's one thing for a patient to come in and say, oh, just make it all good. As a surgeon, as a plastic surgeon, you have to figure out what exactly is bothering the patient and focus on that.
Sure. Doc, what would you do if you were me? Right, I hear that all the time, right? And then you have to ask the questions to see exactly what's bothering them. Because really, you could do everything on a patient. What they really need is just a lower lid blepharoplasty, right? And so the reality is it takes time to get to know your patient, identify what their concerns are, and then craft the ideal procedure for them that's going to benefit them long term.
When people look at me, they may not see my weight first, they may see my beautiful face. And although Dr. Hall had a good face to work with, he made it even better for me. And I see it every day when I look in the mirror, and I see it when people look at me. And when they have a happy response to my face, everything falls into place for me.
Like you said, it takes a while to get to know
Sure.
exactly
Sure.
what you are dealing with this individual patient. So this patient comes in, they're going to be completely different from the next patient, and from the next patient. What I find is that for the most part, when patients come in, for the most part, they're worrying about the neck, the looseness that's here, and the jowls. And this is when we all get in the mirror and we pull this back, we say, oh, that's what I need right there. And this is what we call a lower facelift. And this is what we've just witnessed. This is different from a brow lift.
Sure.
From an upper lid blepharoplasty, lower lid blepharoplasty.
Let me ask you something. So a lot of people...
I don't think you're asking the questions here.
I'm telling you
All
what
right.
you're going to do. You're going to sit there and answer my question. I think a lot of people have come to me in the recent past, it's starting to die down a little bit, say, oh, doctor, I want one of those lifestyle lifts I see on TV. And I want my neck's what really bothers me. My neck, I've got all this loose skin in my neck, and I want the lifestyle lift. What do you tell your patients? And what is a lifestyle lift?
Well,
really?
first of all, we should probably be very, very clear. The lifestyle lift was a trademarked name, really a marketing situation
yeah.
that is at this point out of business. And when a patient is considering having something done, when it requires surgery, they're going to see a surgeon to talk about this, they should do their homework and make sure that they're seeing somebody who they trust, who has been properly vetted. A lifestyle lift was a national company that hired doctors around the country to say, hey, we're going to advertise and market a facelift.
Sure.
And that's exactly what it is. It is a facelift, a lower facelift. And in all honesty, I think one of the things that was certainly in that marketing and in that promotion was, oh, this is done under a local anesthesia. I certainly have done facelifts under a local anesthesia. I think you have done as well.
Sure.
Which way do you prefer, local anesthesia or general anesthesia?
General anesthesia.
Why is that?
Well, you can't be as thorough or as complete and take the time that you need to do what you need to do.
I'm going to argue that the patient's experience is way better
Absolutely.
when
I
you're
agree.
under an anesthetic where they're not awake.
Sure. Well, we're getting the wrap-up sign. So we just saw a really great show with Lauren. We got to see a lot of really cool surgery. I think we've got her in an upcoming episode because there was some additional surgery that you did on her that we're going to highlight as well.
We are, but I don't want to wrap it up. I just want to keep talking. Do we have to listen to these guys?
We do.
Dang it. That means we have to end the show. Listen, we've had a great time today, but don't forget to come back. We'll have some other cool surgeries to see in future episodes. Thanks very much.
See you next week on The Surgeons. Thank you.
Bye-bye.